occasioned by an upsurge in home deliveries. The concern is especially rife in Kisumu County, where medical health institutions are now deploying a new strategy in coping with the situation. Timothy Otieno now reports.
The thing about labor pains is that they strike at any time, and Dorothy Akoth knows this too well. Hers began 3 weeks ago, just 25 minutes after the state-sanctioned overnight curfew had begun. This forced her to give birth to her second-born child at home.
Sasa venye ilinipata, nilikumbuka tu kwenda tu kwa Nyamrerwa ndio ilikuwa karibu. Sasa nilienda huko, alinisaidia vizuri.
The Nyamrwera she is talking about refers to the Luo term given to traditional birth attendants. Since the curfew began 49 days ago, the Kisumu Medical Education Trust, KMET, estimates a decline in the number of clinical births from an average of 40 births per night to just 4 recorded at the Jaramogi Oginga Odinga Referral Hospital within the period in which the dusk to dawn curfew has been in effect.
We are having more reported cases of the maternal deaths because we have more deliveries now than before, because these people fear reaching out to the facility because the providers in the facilities are not yet prepared. Most of them have not been trained.
Dorothy is not the only one who has chosen to deliver at home. Ever since the coronavirus pandemic, more and more women, especially in informal settlement areas of Kisumu City, are laying their trust on traditional midwives to help them deliver, as opposed to medically trained nurses.
Corona imetuletea shida. Juu hatuwezi enda hospitali. Tumeogopa. Tukienda unapimwa temperature, na temperature yako ikipanda juu, unapelekwa quarantine, wanasema uko na corona.
That same fear is what caused Sauda Awino to seek services of the traditional birth attendant who helped her deliver her third baby.
Shida ukienda huko ni unapimwa hiyo mambo ya COVID-19. Juu ukienda pressure inaweza panda na unawekwa ndani uko na hiyo ugonjwa. Sasa hiyo pia ilinibidi nisiende hospitali.
The Kisumu Medical and Education Trust has been struggling to engage more young mothers to deliver in hospitals where it's much safer.
No who responds or anyone.
They have adopted the use of online messaging as well as community health workers to ensure mothers deliver safely.
We normally experience such incident because during this time, women tend to be afraid to go to the hospital because one of the danger signs, there's that high fever, and you see high fever is being related with COVID-19. So some of the women normally are afraid to come to the hospital because of having that high fever.
For Sauda and Dorothy, traditional midwives are just as good as trained medics. And if it saves them the hassle of getting tested and falsely suspected of having COVID-19, then home deliveries are the way to go. Timothy Otieno, KTN News.
So we'll definitely be following up on that situation in Kisumu. But let's remind you of our big key tonight.